Hi, my name is Jennifer Kim. I'm a primary care physician at Stanford University. I started a primary care cancer survivorship clinic to help survivors optimize their health after cancer. I want to share with you how we, as primary care physicians, can support cancer survivors. In her story of surviving retinoblastoma, Melissa gave us an important and powerful perspective on the lasting effects of cancer survivorship. Her experience highlights how cancer can affect medical health and psychosocial issues. These effects often change over time, but may remain prominent issues for the rest of our patients' lives. Cancer survivor refers to any person diagnosed with cancer, starting at the time of diagnosis and lasting a lifetime. All of our primary care practices include cancer survivors. This population is growing. In 2020, there are 17 million cancer survivors in the United States. By 2040, there will be a projected 26 million. The increasing numbers of survivors will impact all specialties. I want to share principles of survivorship care in this course to help you feel prepared and confident in caring for our many survivors. I like to think about survivorship as health after cancer. In survivorship care, we manage long-term and late effects of treatment and tailor an approach to comorbidities and preventive care. Long-term effects are symptoms that start during active cancer treatment and persist after the end of treatment. Late effects are symptoms that start months, years, or even decades after the end of treatment. In primary care, we strive to consider the whole person, addressing all aspects of health, physical, emotional, and social. This is why primary care physicians like us can and should play a key role in our patients' health after cancer. Literature shows that primary care physicians often perceive a history of cancer as belonging to oncologists. But when it comes to survivorship, we have a real opportunity for shared care. Similar to the way we manage chronic illnesses like hypertension and diabetes, we can provide ongoing care for cancer survivors. For example, we follow up with patients with diabetes regularly to discuss screening, medications, and adherence. With our survivors, visits to discuss issues like surveillance and chronic symptom management can also impact long-term health outcomes. As primary care physicians, we are vital to the care coordination and communication with the oncology team. Think of each cancer survivor as having their own path back to health. Identify opportunities to engage in the process. If you see a history of cancer in your patient's problem list, just ask. Consider scheduling a dedicated health after cancer visit, which would allow you to focus on listening to your patient's cancer experience and understanding their present and future healthcare needs. In this course, we provide information to start these discussions with your patients. I'll share some tips and resources I use in my own practice. Let's get started. Please advance to the orientation.